My name is Andrew Spector. I'm a sleep medicine physician in the Department of Neurology. Sleep problems affect the whole spectrum of the population, so I can see anyone from 17 on up to any age. We see a lot of sleep apnea. Restless leg syndrome is another common condition, and I also like to treat narcolepsy and other disorders of sleepiness. I see a lot of patients with sleep apnea who are referred because they've had trouble tolerating treatments for sleep apnea in the past. Specifically, that's CPAP and related breathing devices. And I would encourage anyone to come in and talk that over, because there's a lot of troubleshooting that I can do to make it tolerable for people, and especially people who've tried it years ago. The technology has advanced so far that a bad experience in the past certainly doesn't mean a bad experience in the present. When I'm working with patients, I think the most important thing, especially in sleep medicine, is listening. Because there's very little I can see when looking at someone to answer a question about what might be going on. But if you listen to people and you listen to their families, who are often witnesses to the sleep problem, then you can learn a lot about a patient and you can learn a lot about what's going on. So my primary goal is to listen and gather as much information as I can. After that, we work together to come up with a plan to help people sleep better. And in general, this has to be a collaboration, because I'm not in the room at night. So if this plan that we come up with isn't mutually agreeable, we're not going to make any progress at all. Sleep medicine is very gratifying. Not only do we get to make people feel better, because a good night's sleep sure makes people feel better, but sleep is so important to health. And we know that bad sleep can lead to heart attacks and strokes and diabetes, high blood pressure, heart failure, kidney failure, dementia, and a whole long list of problems, including car accidents, all more common in people with sleep disorders. So not only can we make people feel better, but we make them healthier in any number of ways. And that's really gratifying, because that's a special niche that applies to sleep medicine that doesn't always apply in medicine.